Hey everybody, this is Ben Erickson. This is my final project for AT Still's Functional Biomechanics class. Today we will be discussing a movement that's used in many field and court sports known as the sidestep cut. In order to fully understand what's going on with this movement, we need to first briefly describe some basic anatomy of the knee, which is the primary joint of concern for this movement and video. First, the ligaments. The ligaments of the knee consist of the anterior, posterior, medial, and lateral cruciate ligaments. The primary role of these ligaments is to control the movements of the articulating bones. The main focus of this presentation is the ACL, which primarily works to prevent the tibia from sliding forward during agility, jumping, and deceleration movements. Now the knee moves in four ways: flexion, extension, internal and external rotation. As you can see, various muscles interact to make these movements possible. The main reason for improving sidestep cut technique is to prevent ACL injury. Studies have shown around 70% of ACL injuries that occur are non-contact. Two of the most common maneuvers associated with ACL injuries are sidestep cutting and landing from a jump. Females are particularly susceptible due to various anatomical and physiological differences. Non-contact ACL injuries are usually characterized by increased femoral adduction, increased knee abduction, and ankle eversion, resulting in a dynamic valgus force on the knee. These moments, in addition to rotational forces, can be a recipe for disaster. Decreased muscle strength of the knee flexors and extensors have been shown to relate to decreased knee flexion on the load-accepting limb during a change of direction movement. This decrease in flexion can increase the likelihood of an ACL injury. Knee abduction has also been shown in studies to be associated with trunk lean and rotation in the opposite direction of travel. Now one may ask themselves, why do we care about sidestep cutting an ACL injury? Well, for many athletes, an ACL injury is their worst nightmare. Rehabilitation is difficult, and return to sport, if return occurs at all, is almost a year away from when the ligament was repaired. In a study by DeStasi and colleagues in 2013, only 48% of athletes passed return to sport criteria after 6 months of rehab. Images here are some examples of ACL injury in sport. The injury to the athlete on the left is pretty obvious, but let's take a look at the athlete on the right. This picture was taken just before the injury. At first glance, we may observe what looks like decent mechanics. The ankle, knee, and hip are in line with the opposite hip, level with the load-bearing hip. But look more closely at the load-bearing foot. The toes pointing in the opposite direction of travel and the ankle is everted. What happened was the foot, ankle, and tibia were stuck traveling right while the femur and torso traveled left, resulting in increased torque. The increase in torque resulted in a force greater than the tensile strength of the ACL ligament. This strain resulted in the rupture of the ligament. Here's an example of a 45-degree cut at normal speed with poor technique. Now we'll watch the same video again at quarter speed. Pay attention to the right foot and knee. The stills in this slide show the differences in joint angles between bad and good technique. Hip control is very important. In the left image, we see hip drop in the load-bearing side, which results in increased femoral adduction. This further cascades to greater knee abduction and ankle eversion, which we saw earlier in ACL injury mechanisms. The torso is also turned away from the direction of travel and is centered on top of the knee. A study by Dempsey et al. In 2007 actually found of all the variations associated with sidestep cutting technique, torso rotation and lean opposite the direction of travel are two of the most significant negative influences of dynamic valgus forces on the knee. What we want from our athletes is something similar to the image on the right. The athlete's low in an athletic stance, the ankle, knee, and hip are in line, and no hip drop is present on the left side. The low stance and increased knee flexion is especially important. The increased flexion is associated with greater muscle activation around the knee, which helps to stabilize the joint during this movement. Also notice the foot and torso are in neutral positions as well. There are a number of exercises an athlete can use to improve dynamic strength, which can help prevent ACL injuries during sidestep cut maneuvers in competition. Two of my favorite exercises are the single leg squat and single leg hop. These movements require the coach to provide ankle, knee, and hip alignment, as well as flexion and extension cues, to not only help the athlete improve, but also decrease the risk of injury while performing these exercises. Now we'll get into a few agility drills which a coach can use the previously described cues to help an athlete improve their sidestep cut technique. The zigzag cone drill is an agility drill I like for a number of field athletes. What I look for here is what was described earlier with joint alignment, as well as efficient transfer of weight from one foot to the other. In this particular video, I like the load-bearing leg mechanics, but would like to see less rise in the weight transfer phase. Ideally, the head of the athlete should not rise and fall all that much through the entire movement. Here's the video at normal speed. That was pretty quick. Now here's the same video at quarter speed. The zigzag sprint shuffle sprint drill is a variation of the previous drill, but includes movement about different planes. The athlete first sprints, then side shuffles, then sprints through the final cone. This movement usually incorporates more cones, but for the sake of this video we only use 3 as a demonstration. Here's the movement at normal speed. And again at quarter speed. Keep in mind the same cues as before. The Icky Shuffle is a great agility technique. I like to use cones for this drill for soccer athletes since it's a common drill to perform with the ball. Here's the drill starting on the left. Notice how the hesitation step at the beginning throws off the entire timing of the first half of the drill. With any drill, we want to expose the athlete to both sides, leading with different feet. This time the athlete starts on the right. And again, this time in slow motion. The athlete maintains solid alignment and biomechanics throughout the drill. And that concludes my presentation on the sidestep cut. I hope you enjoyed it. Thank you.